I'm excited to be here because some of you I need to get to or want to get to you. Because I'm part of the Center for Autism. It used to be for OC Kids. 3.5 years ago, it merged into this partnership that includes UCI School of Medicine, CHOC, Family Commission, Chapman University, and grant funded by the Thompson Family Foundation. And we opened one comprehensive center right down the street. We're 1.1 miles away. And one of the first things that we did when we opened was Dr. Joseph Donnelly and I and another team member of ours from Chapman wrote a grant called the Autism Toolkit. And the point of this grant was to gain money, which we have a 3-year grant, to have a 3-pronged approach to get out and reach groups around autism. One prong of the grant is training physicians, providing support and training to physicians so that they feel more comfortable going ahead and making a diagnosis of autism if they feel it's appropriate. And we're doing that because there is a wait list for our organization, and we don't want families to wait and wait for access for medical help. So that is one part of it, that we've begun training physicians to go ahead and for some of what we call sort of the tier 1 children where it's fairly obvious that they are showing signs of autism, to go ahead and feel comfortable making that because it is in their purview as a physician to do that. The other part of it is actually to work with school districts and work with schools and families and help provide more integrated support and communication around the IEP process. And then the third part is my part, and it is about helping community members and families deal with the challenging aspects of autism. So I have 2 prongs to that. One of them, you understand? One part that I have is working with families. So I provided our center, and we have constant trainings going around about managing challenging behaviors and tantrums. We offer them in English, Spanish, and Vietnamese. And we are also offering this June a safety and disaster emergency preparedness training for our families. And I brought with me today a sample of that kit that we're going to be sharing with families that we're going to give to you. So my whole job is the hard part of autism. And one thing that I did was I went out when I first started this project and I met with different people. I went to a couple of different police departments for roll call. I went to, and I want to get with Anaheim, hi. I went to Costa Mesa roll call, I went to an Irvine roll call, an Anaheim roll call, I went to Laguna Beach roll call, and I just asked them, what is your understanding of autism? And they all kind of said to me, we think we kind of get autism. It's, Autism Speaks has really propelled some of that information out. They said, we kind of get it, but we don't know what to do with it. And so we're getting called when children are in crisis, and we're being asked to manage challenging behavior, and our answers are often taking them to the hospital, or restraint, or I haven't heard taser, and basically those are the options. And I totally get it because I see those challenging children, and if you don't know much about them, then that's confusing and it's hard to know how to respond. I also met with parents, and actually what drove this for me was 2 situations that happened. And one, I don't know if you remember a year and a half ago, the family where they were caging their child. That really struck me. The press came to our center and said, what's your answer about that? And we're like, oh my God, we don't know, but this is horrible and it's bad for everyone and we want to help with that. The other one is we've had 2 children killed in the last year, patients of ours. One was riding his bike and he got hit by the garbage truck. And then one eloped from his home. It was a new home he was living in for about 6 weeks, and he was killed on Jamboree one night. That was last September. And so that's kind of driven me in this project. And one thing I've learned is there are a lot of resources out there. There's actually a lot of resources, more resources than I realized. So what I've tried to do is synthesize them and organize them in a plan for people. And that's partly what I'm here to do today. But I'm also here to gather your information. And the idea is in Orange County, we have all of these groups here. And if we can all be working together and coordinating some of those efforts, I think that can only help our families and children. So one thing in your pre-survey, please, if you would just kind of push it forward so I remember to collect them, is I'm curious to see, I'm assuming most of you have some understanding of autism because you're in the healthcare services. And so an understanding of autism is, most people I meet understand autism. There's information out there. How many of you have worked with a child or family in autism in a difficult situation, like maybe trying to take them to the dentist or move homes Or try to have a child who's nonverbal, who's really insistent that they're going to go a certain direction, try to make them go a different direction. Anyone done that? A couple of you? Okay. It's so hard. It is not easy, right? It's super hard. And the thing about autism, as many and most of you know, is that this is a lifelong disorder. And how a child presents with autism changes over their lifespan. And so what might work for a child who's 4 years old, you can pick up a little 4-year-old, you can put them under your arm and take them somewhere with you, but you can't do that to a 22-year-old, right? Or a 30-year-old. And so how that impacts over their lifespan is important. And so knowing strategies across that lifespan is necessary. And we're finding our kids are aging, and they are getting bigger, and they're older, and there aren't a lot of great housing and adult services for children with autism and other developmental disabilities in Orange County for them. People with autism process information differently. Many of you already know that and are aware of that. There's a neurodevelopmental disorder based on social communication deficit and repetitive behavior, really in a nutshell. So I'm not going to spend a lot of time talking about autism. I never know with my group who knows what about autism. There we go. Real quick, the DSM-5 criteria for autism is really about social communication disorders. It could be anywhere from a lack of ability to speak. It could be the ability to speak with some words. There are some children with autism who speak very well, however, in non-purposeful way. There are children with autism that script information. I was working with a little girl the other day, and if you met her, you'd think she's so adorable. She talks, and she's sweet, and she calls me teacher because she has trouble remembering names, and she's like, hi, teacher. And I was helping her with brushing her teeth and going to the dentist. And this is an 8-year-old girl who was screaming and crying when she went to the dentist. Tantruming, she wrecked the room. She was so scared. And so I've been working with her for a few weeks through part of her dental research project that we're doing, and she's been able to brush her teeth. And we've been practicing going to the dentist and watching videos and doing all kinds of things. And we got to the dentist, and it was amazing to me how much her language shifted when under stress. She was anxious, she was scared, and she went to one-word answers. She was repetitive in her language. She wasn't expressive. She couldn't communicate what was happening. She started to cry. And the shift in her language ability when in a comfortable environment to a stressful situation was remarkable. And that's the thing that always strikes me, is just because a child with autism might have language, how that language is used and communicated and how well they're processing language when in a stressful situation, such as an emergency or perceived stressful situation like the dentist. The dentist is very stressful for me. I hate the dentist. I totally related to her. That language shifts depending on your environment. So the topic of today is sort of dealing with emergencies and disasters. A lot of children's language change when they're, even though they are capable of language, how they use language and how they understand language changes when under duress. The other part of that is, what does stress and duress mean for a child with autism? What I might think is stressful, a child with autism might not. On the other hand, I might think, something super easy, and a child may think it's very, very stressful. And the part of autism to remember is that a hallmark in autism is restrictive and repetitive patterns of behaviors or interests. This manifests itself in lots of ways. Some children have very specific repetitive behaviors, right? Those are sort of the classic signs of autism that we see. It might be a child hand flapping or rocking. There might be a child engaged in visual inspection with their fingers, watching fans spinning items. This also manifests itself, however, though, with highly fixed interests, narrow interests, focusing specifically on parts of situations. And that lends itself to rigid and inflexible behavior. That is a tremendous challenge in working with children with autism, is managing rigidity and inflexible behavior. Because what happens is a child with autism is invested in that line of thinking. It's black or white thinking, and they're invested that because I think this, it must be this way. There's not gray, it's black or white. And so we're not just saying be flexible, we're actually asking children with autism to change what they believe and what they think. And that is super difficult. If any of you have had to Very common right now in our political atmosphere. Changing points of view is very challenging, right? Specifically now. And so I started to sort of use that analogy when I'm trying to talk about changing someone's thought processes. So for a child with autism, it's like changing someone from one political party right now to another political party right now. Very challenging. And so what happens is, if a child with autism thinks something should go a certain way, then it should go a certain way. And with that is a lack of ability to have perspective and understanding someone else has a different perspective and point of view, much like our political climate right now. So if I think that this is blue, but it's really red, but I say, no, it's blue. I've been raised to know it's blue, it's blue, it's blue, it's blue. And I say, but other people might have a different opinion. Maybe they're colorblind or they see things differently. Or actually it's teal, not blue. No, it's blue, so I feel it's blue, and your opinion doesn't matter because I don't even realize you have another opinion. They call it theory of mind and the inability to have someone else's perspective. I chuckle with this one because I know a 26-year-old who I consider to be quite bright and lives independently and is highly verbal. But this 26-year-old has never once asked me a question about myself, is not interested, doesn't appear to be interested, I should say, in me. And the funny thing is, if I see her and I say, oh, I'm not feeling well today, I have a cold, she says, well, no, I have a cold. And then her cold's worse than mine. And then she was sicker for a long period of time, and that she just can't do things because she's going to be sick 4 more extra days. And so it's this comparison of I only have my own perspective, and what I think is true is true. And so we're asking children to change that. So imagine if you're in a disaster or an emergency. Maybe there's a fire or earthquake. You have to leave your home, and this is your home. The concept of home is home. And you have to leave now and go to another home. Very challenging for children with autism. And making that even more difficult is that children with autism often are either hyper or hypo, under or over, sensitive to the world around them, this way they process sensory information. So for example, children with autism, if you think of all the senses, they perceive touch differently, they might. I know a 14-year-old boy who's nonverbal, super sweet boy. He had a cut on his foot that was pretty deep and it was bleeding, and he didn't appear to register that. He didn't comment on it. He didn't, even if you hadn't seen the trail of blood, you wouldn't have known he was bleeding. But if he gets a little teeny paper cut, he's out of his mind, angry, upset. It's very painful for him. He often attacks his mother when that happens because he's in pain. And so he registers pain completely opposite than how someone else, you would neurotypically register pain. Same with temperature. This same boy actually is always zipped up. He doesn't register heat very well, and he's always hot and sweaty, but he does not want to take off his clothes. When he gets hot, he often piles on clothes to put on more. And even exploring further, we since learned that he actually has acid reflux. And so when he has acid reflux, it's burning, and so he's putting weight and pressure on him to manage that. I would have never known that. I'm just saying, you're sweating. Take your jacket off. Don't you see how it's hot outside? And he was attacking people. And it wasn't because we figured out he couldn't tell anyone he hurt, he had pain from the acid reflux. He couldn't express himself. And the taking off the jacket was causing significant major meltdowns. But yet he was getting hot and sweaty and dehydrated. And so it's processes like that and how they manage the sensory aspects of their environment make all of this disaster emergency planning super challenging. Children with autism often have trouble with sounds. I used to run a practice in San Juan Capistrano, and it was near the Amtrak station, and it used to crack me up because a couple of very specific boys would all of a sudden stop, and I would think they were blurting out off-topic things, but it actually turned out to be correct. They'd say, the shoreliner's coming, and I'd say, I'm not talking about that right now, talk about this specific, here, we're talking about this. And then sure enough, 30 seconds later, you'd hear it go by. And I'd say, how did he hear that? And he could distinguish between the shoreliner and the Amtrak train by the sound, and it was 2 miles away. And he could hear that. That's how he processed sound. And so there are a lot of children with autism that have challenges processing sound. Either it's too loud, too soft. I spend a lot of time working with children because they don't like to hear vacuum cleaners, right? Or fire alarms at school is a big one. And I've even had to work with children because they can't participate in the fire evacuations at school and fire alarms because they're too anxious because the sound hurts. And it does. It hurts them. And so having to work around and figure out those kinds of things. And so with autism, all these challenges, now imagine dealing with an emergency or disaster, right? This is the part where I start talking really fast because I'm so excited about what I'm talking about. And I know I only have limited time. So anyone feel free to go like, slow down, Kelly, it's okay. But I get really excited that you're all smiling and nodding at me. This is my favorite thing to do. Okay, so I have no answers for you, by the way. I have no fixes, which is why I call all my tantrum classes, I call them managing tantrums and challenging behaviors, because I can't usually fix them all, but I can help manage and cope. And so I always kind of go into these things with, let's help everyone manage better and more comfortably. And I just thought I'd comment that there are, in the new DSM-5 diagnostic criteria for autism, there are levels of support that are noted in there. People used to sort of say severity. Oh, they're mild, they're moderate, they're severe. Well, that was kind of made up, really, because people would just say it. Really, what they're saying is now when a child is given a diagnosis, they are supposed to be noted as part of that what level of support they require. And based on that level of support, it often dictates you what kind of support and services children should have. I'm going to actually... I have handouts that I will pass out, and it's my understanding the PowerPoint will be distributed to anyone that wants it, okay? So knowing that if you have a child who's level 1, you know, they have significant, level 1, they require some support. Level 2, substantial support, and level 3, very substantial support. And this comes down to severity in those categories we talked about, which include deficits in interactions, social communication, and managing your environment. And do you need to know this? No. But sometimes it's helpful to know this because you say, how much support does this child or adult with autism need? And based on the level of severity of the diagnosis, this dictates what level of support should be happening. So what do? There's a disaster, there's an emergency, there's something happening. So one thing to say is no child looks the same. These are all different people, children and adults with autism that I know. They all look totally different. There's no physical feature that would say, oh yeah, they have autism because, you know, I can tell that they have this. And so I've put on here, you might have seen this autism signals and signs. If you go to autismspeaks.org, they also have the MCHAT checklist that people can fill out or look for red flags or warnings. So if anyone wanted to know, like, oh, I'm concerned, there are different links to look for signs and symptoms. Autismspeaks.org. So do you know the autism rates in California public schools jumped 7%? In just 2016, right? You work in schools, you know. 49% of children with autism wander is the new number that they're saying. From 2009 to 2011, their accidental drowning accounted for 91% of deaths in children with autism. And California has the highest rate of that. We're outside, we have more pools, we have more water sources, we have the highest rate in accidental drownings for children with autism. 12% of parents with children under the age of 8 report to be in significant crisis. And by crisis, they mean lack of resources and behavior, mental health, or medical issues. So 60% of families with children felt that way, and 53% with adults felt that way. And so they're reporting to be in significant crisis. And it's funny, the lack of resources, the police department told me, we need resources. And I look around the room and look at all these resources. We have a tremendous amount of resources, but, oh, thank you. For some reason, we're not synthesizing them and connecting them fully. And so in being here today, I'm hoping to sort of maybe make this topic something that we can be coordinating more frequently throughout the next 2 years and how we're coordinating and organizing our efforts. So those are some pretty significant numbers. Thank you. Thank you. Great. So a few other things. So imagine it's a disaster going on. Maybe it's a major earthquake or a flood, or a family is evacuated from their home and they're in a shelter, or they're staying at their neighbor's house. Children with autism have high rates of comorbid mental health issues, anxiety, and depression. As a matter of fact, significant amount of children with autism also have a diagnosis of anxiety. And I don't know if any of you ever get anxious for things. I get anxious for the dentist, which is why it's hilarious I'm on this dental study, because I hadn't been to the dentist in 3 years, and so I had to go, and I'm laying there, and a tear came down my eye. And the dentist said, "Am I hurting you?" And I said, "I'm just anxious, it's okay." And they had to stop and hug me, and they put on a blanket, and they played distracting music for me, and I'm like, oh, I feel so much better. And I have that little bit of anxiety. Imagine if you have anxiety disorder, and you have trouble communicating, and now there's been an emergency and you're displaced from your house. Oh my gosh, I can't think of a worse scenario. And so that we always have to keep that in mind, because when you have anxiety, you have high rates of fight or flight responses. And children with autism can't communicate that if their language is impaired, and they're anxious, and so they might fight or flight, which might mean attack or retreat. Adding challenge to that is 69% of children with autism are picky eaters and don't eat new foods. Children with autism often eat what we call the white and tan diet. You probably experienced this at your school, right? It's carbs, 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 white, tan, carbs. Low rates of fruits and vegetables, low rates of proteins, high, heavy carbs, pasta, crunchy foods. And it is 49% have very specific rituals around how they eat the food. And for instance, I know this little 4-year-old boy who you would look at him and go, he's so cute and adorable. And he's like, "Hi, how you doing? Come over here." And he had significant meltdowns, up to an hour, if his mom didn't put food on the plate certain ways and didn't cut them in certain manners and didn't have the exact plate he wanted in the spot he wanted it. And he would not eat, the sort of, eventually he'll eat, just wait him out. He would not eat for days unless that exact specific routine occurred. So now it's an emergency, it's a disaster, you're anxious, you have trouble communicating, and you're a picky eater, and you have to go stay at someone else's house. Oh my gosh, that's challenging, right? And so on top of that, maybe you have medical conditions. Children with autism have high rates of constipation, partly because they're not eating well. They are struggling in general with bowel movement. They might have fear with their blood drawn. Anyone here have blood draw fear? Oh yeah, right? Oh, it's horrible. My husband passes out. He is literally the person who passes out. He does too.
Otherwise, which is called vasovagal.
Yes, I do know that, because I have to drive him for a blood draw. And so I understand. And so imagine you're probably not feeling very good because you are a picky eater, you're not eating well. You have anxiety, you struggle to talk, maybe you're constipated. Now you have to have your blood drawn? Holy cow, right? What a horrible day you're going to have. And so if you just picture compounding all of these things, kids with autism, I think it's I don't remember the statistics, 65%, I'm kind of fudging that, also don't sleep through the night. Children with autism, on average, sleep less than most children, and in general have rituals around sleeping, and do not sleep through the night, and actually often require less sleep to be active than a typical child. So now they're not sleeping also. And then on top of that, they might have seizures, comorbid epilepsy occurring. All of that, man, they have got it rough sometimes. And now we're displacing them or asking them to manage a fire in their home. And so with all that issue, all of those challenges often come now. We have to change your routine. You have to communicate. And so this new environment, all of this, you can understand why it's hard. And so I'd like to go through this exercise, because if you've dealt with a tantruming child who you're just saying, just get in the car, or just eat the food, or just calm down because the internet wasn't working, and they have autism, it can be so frustrating, and parents are like, oh, I'm at my wit's end. But if you add all that in, you can stop and go back and go, okay, I get this. This is really hard. So let me figure out how I might be able to help you through this challenging situation. Yes?
Would this be the same? I know that you said this was like a lifelong, so I'm thinking as an adult. The adult's going to go through the same.
Yeah, so that's a great question about the adults.
Yeah, what about when you're 24, right?
So, exactly. So I don't have exact statistics, and I should remember all these, and I try to remember them, but I do know that the research indicates that a lot of the self-stereotypical behavior around and the way children process their sensory environment improves in general, even without therapy, improves as children get older. And so, for instance, this 26 that I'm referring to, I know used to hand flap. And then it kind of shifted to, instead of hand flapping all the time, when she got in her teens, when she was excited, she'd be like, oh, this is so exciting. And then as she got in her early 20s, she'd kind of go like, whoop. And we do call it a 3-flapper. Ooh, that was a 3-flapper. She was super happy. And then I saw her, she's 26 and a half, and I saw her and she wasn't flapping at all. I'm like, I can't remember the last time I saw her flap. And so, you know, no attention was drawn to it, and just because of maturity in this, so part of it is neurological maturity, part of it is emotional maturity, and part of it is I've learned some things, I've gone to school, and I've interacted with people in my environment. And so some of those things just improve because a lot of children these days have access to therapy. Schools, right? Schools are doing a good job. There are private therapists. Families are more educated and aware. So in general, a lot of these kids are making progress because they have enriched environments. But for instance, this 14-year-old boy is fairly nonverbal and has been for his entire life. His ability to cope and tolerate and manage his world around him is improved because he's had training and support. Part of it is also we've modified his environment for him, right? And so part of what I'm talking about is some of these kids are going to improve and do really well. Some are going to make slow progress, steady progress. Out there is access to a lot of care now that didn't exist. For this 26-year-old, you didn't have therapy, and you didn't have special education classrooms that were, you know, really trained like they are now. But part of it is we have to help make some accommodations, and that's what I'm going to be talking about today on how to manage those in a disaster situation. Because the children are rigid, they're not sleeping, they're not eating, they're often trying to leave in the area, which leads to aggression, right? So the first thing that I do when I'm talking with families, and we've created a pamphlet that I'm going to pass out with you, is I'm just saying, parents, you have to be prepared. You're the advocate, you're the parent. You have to be more prepared than most parents. And you know, been doing this for a long time, and I do a lot of social skill classes and trainings, and I was talking with this mom, and she said, I just want to be that mom that can go to the playground and sit and read a book while my kid plays. And I said, I'm so sorry you can't. You have a child with autism. That might not ever happen. It might happen, but it might not ever happen. And so you have to be that mom that's out there and playing and facilitating, organizing, and staying on top of it. So I always tell parents, first and foremost, you have to be prepared. And when I'm thinking what that means in an emergency situation or a disaster is, first of all, do you have all your contact information? You'd be very surprised how many families don't have that in general, ready and accessible. If your child goes wandering, you need to know, like, who am I going to contact? What am I going to do? Who are the people around me? Who's the doctor? What's the pharmacy? The other thing is they have to have a copy of the child's diagnosis. I know that sounds weird, but you can't just walk in a hospital and say, my child has autism and believe me, necessarily. You might, but you might not. And so you have to have that kind of paperwork ready in case people don't just believe your word. Sometimes it's obvious, but there are lots of children that are considered, you know, the level 1 support. They don't need a lot of support. They look pretty high functioning until they get in a crisis situation. Then you really see the anxiety and the autism challenges. And someone might not believe they have autism. They might just say they're acting badly. Well, they're acting badly. You're not parenting very well. And so having that copy of that diagnosis handy is helpful. Also, any prescriptions, medication. That might be a duh. But you'd be surprised when I meet families. I say, what medicines are your child on? And they say, well, it's that pink one and the blue one, and I give it in the morning. And that's not helpful in an emergency situation. Maybe you don't have access to the medications at your house in the pharmacy, and now you're in a shelter and you need your child to get their medicine, and maybe they have seizures. You have to have that information handy. It's so much easier these days with phones. There are apps that will manage this for you. And so I work with families about taking pictures of the diagnosis information. There's an app that helps manage prescriptions, like who the doctors are and who the prescriptions are. There's an app for everything. Even if you're just taking a picture at a minimum of the prescription bottles and filing it. And you know, there's always that worry about, is my phone going to be hacked, right, or something? But the likelihood of an average parent's phone being hacked, I think, outweighs the importance of having that information. So I'm always having my parents take pictures of all that stuff. Any medical equipment that might be needed, GPS tracking information. I'm going to have a whole other slide about GPS and tracking information, and a few favorite foods. I know this boy who comes over every year from Dubai. His family they fly here in the summer, and he every year shows up without fail. They're starving me! They're starving me! And he screams and he carries on and he goes on a hunger strike for 3 days because he doesn't have the food he likes from Dubai. And so now I'm just with his parents, can you just pack it? Help with the transition, bring it with you, those couple of favorite bars that he likes to eat, and let's help him get through that transition every year. And just having those foods ready in a crisis are helpful. Any favorite or comforting items, have those in your, poor moms, I'm always all over. I'm like, you need the food, you need all the information, and you need a comforting item of some kind with you in the bag. And then any visual schedules, and the number one schedule I tell parents to use is first this, then this. Because with children with autism, what happens is, because of the communication challenges, even someone who's fully verbal and looks like they're average in their verbal skills, struggle with that perspective taking. And so the example I like to give is if I say, okay, it's time to get off the computer now, and you start screaming and carrying on. Most neurotypical children will say, Mom, I need to save this first. And if I don't save it, I'm going to lose all my levels, right? I don't know the game, so I'm just going to say, get off now, it's time to go to bed. And you say, but Mom, wait, I have 30 seconds till I save it. You say, okay, you have 30 seconds. A child with autism may not pull that off. And so it's just like, wah, ah, screaming because they don't have always the ability to express all that. And so I'd like to teach parents and kids this concept of first this, then this. So as a parent, I could say, first get off the computer, then you're going to eat dinner, then you can go back, for example. Or I have a child say, first save, then dinner. And so everyone can sort of have this language of expectancy, like, okay, I'll do this thing you want for me, but I also need to be able to do this thing I want to do. And it just sort of, in the short language, gives everyone that ability to communicate, like, okay, this is what's going to happen, this first, then this. And so at a minimum, when I'm talking to parents about being prepared, this is the information that I give them. The other thing is I can't say enough about visual supports. Schools do a really good job with this. In general, I looked up earthquake plans, and there were some pictures. Children with autism respond very well to visual supports. And so one example is a social story is in our world. We call it a social story, which is basically a visual explanation of what is expected to happen. And so if I tell you what to do, and you have autism, you might not process that language. You might not have been paying attention to it. Or 3, you might not just feel like listening to me, right? Which all 3 can happen at the same time or independent of each other for a child with autism. But I can't argue with the words because that's concrete and it's there. And I also, if I can't read, I have the pictures. Now, these should be supplemented with visual support, with auditory language, because we want children to learn to listen to your words. Often children with autism aren't attending to what you think is what they should be attending. We call it that they're missing the salient cue. So I'm up front talking. My presence up front is important. I'm facing you, you're facing me. I am the obvious salient cue in the room, I would think, right? Maybe not. But if you have ADHD or autism, and many children with autism also have ADHD, I might not be more important to you. There might be something over there, like for instance, the map that's over there. Lots of children with autism are drawn to visual information like that. And I can think of 3 kids I know that would never pay attention to me because that map is super cool to look at, right? Or they might be looking at the clock and counting down the minutes till I'm done and they can get away from me, right? Maybe some of you are doing that. The sounds, I hear a buzzing noise. I'm always sensitive to the sounds in the room. And so I hear this, I think it's maybe over here is happening, and that might be overriding what I'm saying. And so children with autism, that's why they struggle in school. That's why they often have one-to-one supports, because they struggle to recognize the salient, we call it like the gestalt. What is most important in the big picture versus the specific, less important information. And the way to help support that is the use of visual supports paired with your auditory language. The other thing that I'd often say is sometimes people joke and say, how did you get that boy to do that? And sometimes I literally one time went to a boy and I touched him on the shoulder and I went, and he went. And I didn't say anything. But as the other person had been saying, get up, you need to go over there, go sit down in your seat, go sit down. I said, go sit down, come on, it's snack time, go sit down, sit down, sit down. Went over his head, and I just touched his shoulder, got his attention, and I went, and then kind of went like that, and off he went. And that doesn't work for all children. That's the thing, not one thing works for all children, but visual supports, the gestural support, the touch cue to gain attention, and the use of gesturing to the chair, all that visual support, children with autism are less likely to argue. In that situation, I once had a boy argue with me and say, I'm not going to sit down, I'm not going to sit down, I'm not going to sit down, I'm not going to sit down. And I just stood, and he goes, oh, all right, you're obviously not giving up. And he went and sat down. And I never took the verbal debate with him. It was just all very nonverbal, and he couldn't argue with my finger because my finger was telling him what to do, and it didn't argue back. And so the concept of visual supports and gestural, all that visual communication is often highly effective in an emergency situation. So for earthquake plans, visual supports in schools, the role playing of the experience, families organizing the plan and what that looks like, but most children, a high rate of them will respond to this. And some has lots of words, some of it's just very minimal, drop, cover, hold. It's that simple. I just realized there are people on the phone that aren't seeing my visual support. So I apologize for that. Those are the people typing on their computer anyway. So, sorry. The other part is fire safety plans. Families don't have fire safety plans. I remember in school they required us to do this, and I had to go home and tell my parents we have to set up our fire evacuation plan. And I don't know that that's really happening anymore. But we are asking families to do that as part of our safety class that they take with us. And again, it's the same concept of visual support, either a written social story that explains exactly what should happen, or a simplified version of visual that should just happen, just stop, drop, roll. The other part of our planning is evacuation meeting points. And you have to really take that into consideration with children with autism that might wander. Right? And so we also work with families to talk about if you're going to have an emergency meeting spot, what does that look like and where is it and what kind of access is it to a street or maybe to a water area because of the high rates of drowning. The next thing I will talk about a little bit is law enforcement, and this is like 2 slides. And I want to get with any police officers or sheriff departments or fire departments, and we will provide free training. And I have a specific PowerPoint and training that I will do. I really want to reach out to you guys. I've been trying. I think a lot of people feel like they understand autism and totally get it. And when I heard that information, I've really worked hard to try to help say, well, what are the takeaways? What could you do? And the thing to think about is one of the high rates of children with autism wander, and they're missing. And they often dart into traffic. And so I'm working with families to go and register their children with police departments. And the police departments say, you can't register your child. There's nothing to register. And I say, I know, but go tell them anyway. And we've created a form for families to take to the police department with a picture of their child if it's a known wanderer. And and GPS tracking information and all of that. So the second a call goes, if it gets to that police department, they can say, oh, we know this child, and they have a tracking device. Let's pull that up. Let's organize our efforts and help make that, and hopefully reduce that time in searching. Other times, children with autism are often victim of crimes. They can't tell you it happened, right? And they have challenges reporting. Other times, our children with autism are getting in trouble for sexual harassment. They are doing what other kids tell them to do. And they don't understand that. And I'm often called in situations where kids the police are there at the school, they've been reported for sexual harassment. They, in fact, as it's written, did engage in sexual harassment. And if you ask the child, they didn't really understand why they did what they did and that it was wrong. And so I'm working with families to put those kinds of things in IEPs, to safeguard the child a little bit. Not that I think what they do is right, but I know a boy who kept going around and slapping girls on their butts because other boys told him to. And he was doing it, and he did not understand that it was wrong until, sure enough, the police were there and he was suspended. And so, and even though he knows it's wrong, what he told me was, well, how come they do it in football? And I said, you're right, but you can't do it to girls. And they said, well, how come sometimes I see it on TV and in movies? And I said, you're right, but you can't do it to girls at school. And so having to explain all those social rules. And so sometimes our kids are getting in trouble with law enforcement because they don't understand that. And they have driving accidents or incidents because of over or under responding. In the other situations, domestic disturbances, they're aggressive at home. And parents are calling the police for help, right? And so it is not uncommon for a child with autism at some point in their life to come into contact with law enforcement. So again, I'm offering our services to work with law enforcement to help provide some more support around that. But the things that I will add for law enforcement is children with autism might not respond. Or what I actually hear more often is they're rude. And they don't know they're rude. They're rude in general to people because they don't know how to manage their tone of voice. And a lot of children with autism use telling words versus asking. They'll tell you things when they really mean to ask for clarification. So they'll tell you this, they'll tell you that. They have a tone of voice that is off-putting. I have about 6 boys I'm working with right now, and they're all just rude. And they don't even have any idea they're rude. And they will treat me as though they're equal to me as far as age and cognitive ability. And I have to say, I literally find myself saying things like, okay, you're 10, almost 50. Let's talk about what that means. I'm like, well, I'm as tall as you, so we're the same. Nope. Okay, we're all right. Maybe we're the same. No wrinkles on this face. And they say, well, you don't. And then they go, you don't look that wrinkled. And I'm like, oh, you're so cute. And I'm like, oh, no, not what I'm talking about. And I have to actually spend time with them discriminating that we're different and that I'm the adult and they're the child. And that's a really hard concept for a lot of kids with autism. So if you go to a police officer and you act that way, you're in big trouble, super big trouble. And so children with autism need training in that, but also work with law enforcement to maybe, hopefully, I know it's hard, but in a certain situation, take a minute and go, wait, maybe they're not as rude as they seem. What other factors are happening right now that might indicate they have autism? They might respond off topic. They might repeat back words because they have echolalia and maybe they're anxious and so they're just repeating, like, what's your name? What's your name? I said, what's your name? What's your name? Right? And I know lots of children with autism, it's called echolalia. Repeat back what you're saying to them because they can't find their own words. And do you know how mad you'd be as a police officer if you feel like someone's mocking you, right? And so you're like, don't mock me. Especially if you're a 28-year-old male, right? You wouldn't expect that response and that might come across as mocking. They might respond bluntly or rudely, use scripted language. They might also pretend to know what you're talking about and agree to everything. They might not show any fear or acknowledge that you're an authority figure. They might have, their physical features don't look different. They might have space issues and get too close. This 14-year-old boy I've been describing who bundles up in the sweatshirts and all that, he gets really close to new people. And he actually does something that I cannot get him to stop. He strangles you. But he doesn't mean to strangle you. He just puts his hands around your neck in it's like how he hugs. And he comes up and he goes like this. And if you don't know, he's taller than me and he comes at me, strangling me, and I know he's not doing anything because I know him. But he actually did that at McDonald's to his grandmother, and someone called the police on them, and the police showed up, and thankfully, it was Tustin Police Department. They responded beautifully and understood it. They recognized right away the boy was nonverbal. He became upset because of everything, the commotion that was happening, and they were really great at how they helped the grandmother get him in the car and respond to the situation. But it looks scary. He comes right at you like this, like he's going to strangle your neck. And so all those are challenges, right? And so if you're a law enforcement and someone's coming up to you to strangle you, you're going to take that as an attack, and I totally understand that, completely understand that. And so working to help sort of navigate and judge, is this person just not understanding space and ways I can move to take a quick assessment to see if maybe there's autism or not autism or something else going on. And so that's part of what happens in challenging situations. The last few things I'll comment is these very simple supports like these 3, and for people on the phone, it's a first this, then this visual, a stop sign, and a timer. These 3 things are a must in emergency situations. If I can get a child to understand, first you have to come to this place, then you can have your video, or stop, this is dangerous, or you only have to stay here for this amount of time or this many days. These 3 things don't fix everything, but they are really helpful across the spectrum of autism in some manner. And so for parents whose children wander, I will have them put big stop signs in their house. and I'll have them say first, tell mom, then you can go outside, and sort of create those situations to put some boundaries around emergency situations. The other thing I'll add is that children with autism can be distracted, and I'm a very big fan when a child has become aggressive of distraction. Lots of people disagree with me on this. I feel very strongly, and I counsel my parents, if you're out in the community and your child's about to run into that street, I don't care if you give them an iPad, I don't care if you give them a snack, if you're tickling them, whatever it takes to distract from the cause of the frustration and anxiety to keep them safe. And we're not giving into behaviors, we're not reinforcing bad behaviors, we're distracting to prevent more serious behaviors. And so when children go to the hospital or they have to go to a new situation or a shelter or some kind of situation, I like children to have access to distracting kinds of things. And honestly, you can't go wrong with an iPad or a phone, right? Kids can find anything with that. And so sometimes I call it bribing, sometimes I call it distracting, but these kinds of things. So if you're law enforcement and you show up in someone's house and the child is tantruming, I get called sometimes, and I will say, what is it they want? Let's get them that till we can de-escalate this situation, then try to solve it. Now is not the time to solve it because they're heightened, they're anxious, they're angry, parents are upset, child's upset, is not the time to solve it. I'm not going to fix it. I'm not teaching anyone a lesson. I'm just distracting, getting everyone calm at baseline, and then making my plan. I also have a list of intake questions. I did do a training at Chalk Hospital with the charge nurses and worked about maybe making some changes to their intake questionnaire, because a lot of kids are going to the emergency department, right? Or being admitted for medical and health reasons. And it does not always show up that they have autism in their chart. It's supposed to, but I get why it doesn't. And if the parent doesn't have a copy of the diagnosis with them, everyone finds out the hard way. And so I've been working with people with specific intake questions around what's their favorite activities, what are their interests. That's all based on distractions, the concept of distraction. What makes them anxious? Are there any sensitivities to lights or sounds? You want to know that before you're in it. Trust me. You want to know if a sound or sight of something makes a child anxious before you put them in that moment. Do they have any fears or phobias? Lots of children with autism have irrational fears. I have some irrational fears, right? If a spider walked in this room, I would be out of here. In my car, down the street. If it was a tarantula, never coming back. Irrational, I know. Snake, I'll pick it up all day, right? But we all have irrational fears. Children with autism, because of that specific thinking they have, often have very irrational fears. Hospital, needles, dentists, big sources of anxiety for children with autism. Anything that might upset them, specific ways to calm your child, information I need to know. These simple intake questions, information, if someone's going into the hospital or the emergency room, could make or break a positive experience for a child on the spectrum and their family. For parents, we have a going to the hospital checklist, and it's similar to what we've talked about. Get their favorite things, favorite foods, calming, comforting items, novelty toys that maybe they haven't had before, and you've saved it for that one day when you really need something. Now's the time. They're going in the hospital, pull out that new app, pull out that new stuffed animal, but save it for that. Any communication aids, and family photos, because family photos of people that you love can be very comforting for children with autism. They might not be able to say, I want my mommy, I miss my mommy, where's my mommy, or where's my daddy, or my sister, or my dog. And so having those photos, because of the inability to express that feeling, can be super helpful. Comforting items. Anyone, you go to the dentist or you go get x-rays and you have, they put that leaded apron on you. Have you? Feels great. Feels super great. I make them put 2 on me at the dentist, right? I say, put them on, it feels great. They make something called weighted blankets. You can buy them. Lots of parents make them. There's a video how to make a weighted blanket. I have in my office bean bags, a big pillow like that, and a weighted blanket, and 90% of children that come in that are super distressed, if I put them in this room with the pad on the floor, a bunch of bean bags and a weighted blanket and something to climb in, like a tent. I have a big one too for older kids. They will calm, and it's dark, they will calm down. And so this sort of nature, I'm just trying to calm down. We're trying to de-escalate, calm ourselves down, and then let's start over from baseline. And so I have distraction, and I have calming items, I have visual supports. Those things can get you through a lot of emergency or disaster situations. And then, sorry, go ahead. And then movement opportunities. If you're in the hospital and you can't get up and you're a child with autism and you're restless, that's really hard. And so I know I worked with Chalk to build in movement opportunities and space to walk around, and spaces the kids could go in, and spaces that maybe they could put some beanbags and weighted blankets and rooms where they could just have a different calming location. And so just opportunity to move around and pace rather than stay in one spot. Sorry, the last thing that I'll say, this is a social story. The last thing I'll say is wandering. If you go onto autismspeaks.org, they have a list of GPS trackers. There are all kinds of trackers. Any child has a chance of eloping, I suggest this. They have everything from a kind that just hooks on you. You can sew them in clothing. There's a foot insert one. I like the foot insert one a lot for kids, because most kids, if they want, are going to keep their shoes on. They might take clothing off. They might pull off a tracking device. But the foot one seems a little bit likely. And some are free. Some cost money, depending on what you're interested in. And they usually hook up to an app on your phone. And so the very first thing when anyone we work with encounter has any chance of eloping or leaving their family is we ask them to get a tracking service, a GPS tracking service. And this website, ifneedhelp.org, is a new group that actually has all kinds. They have signs. You can go on their website and they'll send you kits for all ages, signs you can put in your house, things you can sew into clothing, opportunities for tracking devices. They even have one, a scent tracking device, where you take a child's piece of clothing and you put it in the freezer, and if your child gets lost, the sniffing dogs recognize the scent, and off they go looking for them. So these sites, these two sites, have all that kind of information that families can access. And the other thing I'll say is pool alerts. If you have a child who's gone missing, the first thing that we always say is find the local pools first and the water sources, because their kids with autism are drawn there, and of the high rates of drowning, first check are the pools and the water sources. So I'm going to end today with this. We have developed a family emergency and disaster preparedness kit for families. It walks families through situations like a home plan. It starts them off with a home plan. Are their fire alarms up to date? Do they need flashing lights on their alarms because they can't have the sound? Some children with autism freak out. They're so scared with that sound. Maybe they need an adaptive one. Do they have an outside meeting place? Do they have exit routes planned? Do they have a separation plan? Do they have a disaster kit ready? It works them all the way through a fire evacuation. It walks them through earthquake evacuation, wandering information, hospital stay, and some of the topics I talked about, but it has worksheets like this where parents work through those situations for them. And when they get, for instance, the fire, if they have a wandering child, there's a letter that they can just fill out and give to their police department and say, here's my child, they have autism, they have this tracking device, here's what they need. Here are the medications they're on. And it also helps families set up a phone tree to call people if they need help. There's also something called the Big Red Toolkit that's online that was put out by the National Association of Autism, and we've adapted that for families because it's a little bit more of a working document, but that's another opportunity for families, and that website link is in your handout. So I'm going to stop for today. Thank you so much. I'm going to leave these if anyone wants to have copies of them. We are going to be posting them on our website in the next month, and we will be doing a training at our office for families. The safety training will be very, very low cost or free. And again, we also have coming up, I have 3 managing challenging behaviors and tantrums for families, one in English, one in Spanish, and one in Vietnamese. And if you go on our website, the center, I think it's on this last handout, the centerforautism.org. Here we are, the centerforautism.org. That's where we list everything that's coming up. That's my email. If anyone here wants to get in touch with me, have other trainings or workshops or planned, I'm thrilled to do that. Then autism, the Big Red Toolkit's on here. And I'll also let you know there is an autism response team that is on the Autism Speaks website. We are what's called an autism treatment network. We're one of 12 in the country. And so part of it, our involvement is developing these materials to distribute to families. And so there's an autism response team. So I'm going to leave these 4 people. I'm happy to hand out more. And then is there any questions? Great, thank you. I'm going to distribute a post survey, and this is really just for grant funding to continue with our UniHealth grant, and I want to thank you so much. Thanks.